This is Scott Oliver, and I'm working on my fourth book, which is called Stem Cell Angels, all about the very experienced offshore doctors who are literally transforming bodies, minds, and lifestyles with stem cell therapy. Today I'm sitting with Dr. Scott Melrose, who's not a stem cell therapist, but is a very happy patient of stem cell therapy, and we're going to ask him a few questions about his experience. Good afternoon, Scott.
Good afternoon, Scott.
So, you've been what sort of doctor for how long?
Been a chiropractor for 26 years, primarily wellness. I do some trauma care with motor vehicle accidents, but it's mostly wellness and exercise, diet, lifestyle. And prior to that, I was in emergency medicine. I was a paramedic and a dive medic for almost a decade, and team trainer for 2 sports teams. And
you've seen a few injuries?
Seen a few injuries.
And when was the first time that you discovered or looked into or heard of stem cell therapy?
Probably 2015, I was starting to do some research on it. 2016 was the first time that I reached out to Dr. Zahra at Stem Cell Healing Institute, and we started actively talking about how my family could benefit from some stem cell therapy.
Okay, so you're not only a chiropractic doctor, but you're also a patient of a stem cell therapy doctor?
Correct.
Okay, and what sort of results have you seen personally?
Personally, I mean, I'm pretty early into the recovery phase after my stem cell therapy, but we've also already seen some pretty dramatic results. I've got a few aches and pains and issues that have crept up over the years as I'm getting older. One of them was called Dupuytren's contracture, which is basically where the hand starts to bend and you can't straighten the fingers anymore. And so we did stem cell therapy on that, and now I've got a relatively straight and functioning hand again, which has been amazing. We also, part and parcel with that, I had a Western medical treatment where they were tearing the cords with needles in order to straighten the finger. And as a result of that, I ended up with a tremor in my hand. We're not quite sure what the correlation is, but soon afterwards I ended up with a tremor in the hand, which was starting to become problematic. And so we've done intranasal procedure as well as an IV procedure to try to address that. And once again, we're relatively soon after the treatment, but already today I've got basically virtually no tremor in the hand, full function in the hand, and good strength in the hand. Part and parcel with that, and we won't get too graphic, but a lot of people that have Dupuytren's contracture end up with something called Peyronie's disease, which affects the inguinal region and the apertures down there where they're no longer straight and that. So we did some procedures on that, and early results look quite promising there. And
so, I mean, Canada is certainly considered to be a first world country. Why didn't you have these things seen to in Canada?
Well, stem cell therapy in Canada is only for research purposes. We can't ascertain it as a viable treatment. There's 1 or 2 clinics that are claiming they're doing stem cells, but from my research, at best they're doing PRP work. But as far as the stem cell therapy goes, the Stem Cell Healing Institute is the most all-encompassing treatment that I've seen in the world, and that's one of the reasons we ended up here back in.
So you had to travel from Canada to Guatemala to have this state-of-the-art treatment?
Yes, this treatment is not available in North America.
Okay. I'm not an expert in these types of things, but in your personal opinion, I've read articles about stem cell therapy being proven to be effective for numerous conditions, and not just, National Enquirer type sensational press, but scientific papers. So if it's a proven therapy, why are we not allowed to do that in Canada and the United States?
Well, it's certainly outside of my expertise to talk about the intricacies of it, but from a knowledgeable layperson on the outside, it works too well. And the medical system doesn't want to look at things that work well. I'm a firm believer that I think our medical industry, first of all, should never be called healthcare because it's only disease care. I don't think they're interested in health. And yeah, like I say, basically it works too well. They don't want competition. And I know that that's a borderline heretic thing for somebody to say in my position, but I honestly, at this point, that's what I think is the truth.
Well, sadly, I believe you 100%. And I had, years ago, a magazine in the sleep field, which specialized in helping doctors who specialized in sleep. And as part of my research, I looked into the education of your traditional medical doctors, both in the United States and in my country of origin, in the United Kingdom. And they talk about the 3 pillars of health, of sleep, nutrition, and exercise. And with my research, which doesn't take a long time, it became apparent that your average medical doctor in medical school spends less than a week being educated about sleep, nutrition, and exercises, the 3 pillars of health. So yes, I certainly concur with your opinions that perhaps this is a little bit too efficient for Big Pharma to enjoy too much. But I mean, there are obviously stem cell therapy clinics around the world. I mean, I've seen clinics in Mexico, in Colombia, even in the Cayman Islands, also in Costa Rica where I lived. Why did you end up choosing to work with Dr. Zahra Figueredo?
Well, there's 2 main aspects to it. One, I do have some friends in Guatemala, so it was easy for me to come down and explore what Guatemala was all about. Sometimes it gets a bad rap, which I don't think is justified. It's been nothing but an amazing country to come and visit, and felt safe the whole time. I think in Canada you can get in just as much trouble by going to the wrong neighborhood as you can in Guatemala. And people here have been absolutely amazing and gracious, and there isn't a person you would pass on the street that doesn't say good morning, good afternoon. And my Spanish is a little bit dodgy, but I always reply to them. And it's a magical country. It's exceeded my expectations.
And it's the land of eternal spring.
And the land of eternal spring. Yep. And so why Guatemala? Because I had the connection with a couple of friends that had moved down here. Probably the biggest single thing, though, is as being, I would like to think, a good consumer. I did my research, and this is the most encompassing program that you'll get as far as stem cell goes. The care before and the preparation before, the treatment, the care afterwards is not seen at any other clinic that I've seen.
Well, you're a doctor, obviously, of chiropractic, and I'm a firm believer in treating the whole person, as I know you are and as I know Dr. Zahra is. One article that I am working on is about the average time that a doctor sees a patient in the United States. And, if we're talking about treating the whole body with, questions about perhaps sleep or nutrition or exercise, it makes you wonder what can be achieved, because the average time that a patient spends with a doctor in the States is 18 minutes. That includes documentation time. So in researching what I'm doing for my new book and looking at Dr. Zahra, it would appear, and I'd love your professional opinion, that her actual treatment itself, the stem cell therapy treatment, is also more comprehensive than the majority of people out there. Would you say that's true?
Yes, 100%. And the other thing too is, I always look for the positives and give everybody the benefit of the doubt. I don't want to be anti-medicine, because let's face it, if my arm fell off tomorrow, I'd really like somebody to sew it back on. But as far as
chiropractic adjustments would be difficult too.
Yeah. But as far as what we were talking about and the average medical doctor, they just don't have time, and it's the system that allows them, or does not allow them to have the time. And so I think they're handicapped with what they're doing. I think there's many of them that are doing a fantastic job. Actually, most of them are doing a fantastic job. And, we still need conventional Western medicine. We can't do without it. But as far as, once again, calling it wellness, health or wellness just doesn't come into their paradigm, I don't think.
Well, I've heard Dr. Zahra talk about how she treats the whole person rather than your regular doctor who's treating a symptom or a disease.
Yep.
And at the end of the day, if you're treating the whole person, you will also treat the system and the disease, but you happen to make a hell of a lot more improvements,
And I think more importantly, by treating the whole person, we can stave off things in the future.
Yep. Yeah, it can be preventative as well.
Yep.
Okay, good. Well, apart from that, you as a doctor who has the experience that you have, would you suggest that there are certain types of conditions that would benefit most from stem cell therapy? If so, what would you say those are? And who are the types of people that should be contacting Dr. Zahra at the Stem Cell Healing Institute?
That's a harder question, probably in the last 10 years. I think it's changed. I think, obviously what I do for a living, I'm a musculoskeletal doctor, so we deal with movement issues, joint issues, malpositions of different parts of the spine, which ultimately can cause dysfunction. Mm-hmm. So I think just about anything, well, actually anything to do with the musculoskeletal system, I think there's a role for stem cells in that.
Yeah.
From a wellness and a longevity point of view, I think it's immeasurable what stem cells can do. And I really think that's where we're going now. I'm getting older, so I'm a little bit prejudiced, but I think longevity and quality of life is huge, and with the rejuvenation aspect of stem cells and doing the whole body rejuvenation, I think is amazing what we can do.
Talking about whole body rejuvenation, I know you've just had a treatment here. I'm not going to ask you to discuss personal details if you don't want to. Mm-hmm. And obviously it's it's been a few days, so you're not going to see any major improvements for mm-hmm. probably quite a few months. But can you give us an idea of why you chose to do this treatment, if you've seen any results whatsoever, and what you anticipate happening in the future, what sort of benefits you think you're going to enjoy?
Yeah, so we're 5 days out. 5 or 6 days out. I can't quite remember. It's been a busy week. And already, the flexibility in my hand and the comfort in my hand has been amazing. Part of the disease process for me in the hand was getting as simple as blowing my nose and my index finger would dislocate. And I can say in the last 5 days I have not dislocated any of my fingers or had them out of position, which is quite refreshing because it was getting a little bit tiresome where you're constantly trying to reposition your own fingers. As far as kind of the whole body rejuvenation and that we did, even although I'm very, very tired because it's been a busy week, clarity, thought process, calmness, kind of almost a calming effect of the brain, for lack of a better way of trying to describe it, has been amazing. The other parts I don't know that I can talk too much to right at this point because with the Peyronie's disease and the function down there, my wife didn't travel with me this trip, which is the first for quite some time, so I can't actually tell you how everything is functioning or performing at this point, but early signs are encouraging as far as everything being able to function properly again.
Excellent.
So.
And you did mention quality of life earlier in the conversation,
Mm-hmm.
and if I could just chat about that. You're obviously a successful doctor, assuming you probably have more, let's use the term, financial wherewithal to make these investments in your health. Mm-hmm. But a lot of people do believe that stem cell therapy is very expensive. But could you just share a few words about how you feel about this investment and what you're actually investing in, and whether, of course, it's good value for money?
Well, obviously, I think it's good value for money, otherwise I wouldn't be here. I mean, I'm 3/4 Scottish, which, as we know, tend to keep their pennies
And I was
tight.
born in Scotland, so we're good there.
And the other side is Danish, and they're just about as thrifty. So certainly, it wasn't an easy decision as to spending the money right now. I've got 2 adult kids that are just finishing up university, so that was a big investment for us as well, because we're firm believers in education, so we paid for all their education and that. But as far as the investment goes, no, I think the investment was worth every penny. I'm only 5 days out. I'm excited to see, what the next 1, 3, 5, 10 years is going to bring. I'm already, somehow the body just feels calmer, stronger, and not apprehensive about trying anything new. Not that I was getting apprehensive about it, but it just feels like things are more comfortable in general. As far as the investment goes, I mean, when you actually do your research and or you do a little bit more delving into what's all entailed, there's multiple professionals, there's multiple hospitals, there's multiple testing. The personnel, it's a very labor-intense procedure. Lab time in order to process the stem cells. So I think the investment and the return on the investment, I don't even hesitate to recommend going ahead.
Well, it's highly skilled labor costs.
Yes.
And, for me personally, it's difficult for most human beings to anticipate what's going to be happening in the future in any field, but especially in your own life. And, you obviously meet people every day who are plagued with pain. Pain is an incredible motivator, but we don't quite know when that pain is going to start. I mean, for most people, they're going to begin one day where they've got a pain, another day they may have another pain, and that cumulatively can obviously dramatically affect your quality of life. So if you can avoid that, you have to ask yourself, well, how much is it worth to invest in not having that situation, but having the next 10, 15, 20 years or whatever it is that I have left in my life, maybe not being pain-free, but maybe dramatically reducing that level of pain.
I expect to be pain-free. But I also walk the walk and talk the talk, so I eat a healthy diet, I exercise 4 to 5 days a week. One of the analogies that I was talking with a patient and some family here not too recently is, being a past EMT, I've carried a first aid kit in my car my whole life. The only time I need it is when I don't have my car. And so I live my life of, let's be prepared for what possibly could be coming. And that's one of the reasons I've done the stem cells as well, is that, there are some genes on both sides of the family that there is some illness there. Some things that I don't think are hereditary, like I think, there's a very small portion of cardiovascular disease and lifestyle changes that are hereditary. I think those are personal choices, and when we make a choice to exercise and eat properly, I don't expect to have any of those things. Now, if the stem cells have given me an insurance for that so that there is no cardiovascular disease in my future, I think that's immeasurable as far in my view.
Wonderful, thank you. And for anybody that's actually watching out here who has questions about stem cell therapy, who's thinking, well, would this work for me? What would be your encouragement?
I think there is very few people on the face of the earth that couldn't benefit from stem cells at this point. I mean, there are some contraindications. There's some, like cancers or that, you certainly can't start doing stem cells with active cancers and that, but short of that, there's not too many illnesses or diseases that I know of, or conditions, musculoskeletal conditions in particular, that couldn't benefit from stem cell therapy.
Beautiful. Thank you for that. So for those of you who do have questions about stem cell therapy, whether it's right for you, what sort of investment would be required, first of all, thank you, Scott, for your expert feedback. Please reach out to Dr. Zahra Figueredo. Either she or somebody on her team will get back to you. She is at the stemcellhealinginstitute.com. And this is Scott Oliver saying, hasta luego.